Hi, I'm Dr. Charles Denham. Today's briefing is on active shooter events in healthcare facilities. We'll address some of the issues brought up in a recent New England Journal of Medicine article.
In the article of August 9, 2018, entitled Active Shooter Response at a Healthcare Facility, the authors say, and I quote, "The run, hide, fight response to an active shooter event may work in many places, but healthcare facilities should consider a different approach: secure the location, preserve the life of the patient and oneself, and fight only if necessary. Secure, preserve, and fight." Having helped strategize this very issue at the world's largest medical center, I agree very much with the message of this article. In fact, we developed simulations and case studies to address the unique characteristics of the challenges we face in healthcare facilities. Active shooter events have been on the rise throughout the United States. Defining such incidents as situations in which, quotes, "an individual or individuals are actively engaged in killing or attempting to kill people in a confined and populated area," unquotes. Although the article quotes the FBI data from 2000 to 2013, very recent data from the FBI has identified 250 active shooter incidents between 2000 and 2017, in which 799 people were killed and an additional 1,418 were wounded. In the first half of that period, there was an average of 6.7 incidents per year. That number tripled to over 20 incidents per year in the second half of that period. It is interesting to note that healthcare facilities are among the top locations for active shooter events tracked by the FBI, with the same number of incidents as faith-based organizations and malls. We agree with the author's message that healthcare facilities are they themselves high-risk targets and must be prepared as potential sites of an attack. The authors cite the Callan et al. Study that examined all U.S. hospital shootings between 2000 and 2011, in which there were at least one injured victim. They identified 154 incidents in 40 states, causing death or injury to a staggering 235 people. The Department of Homeland Security, working with HHS, DOJ, FBI, and FEMA, have also developed a planning guide specifically for healthcare facilities. These plans focus on training participants to respond by running to safety if possible, hiding if running is not an option, and as a last resort, fighting off the shooter. Run, hide, fight. Unfortunately, for certain caregivers who are tending to vulnerable populations of patients, this approach is untenable. Many believe that they have a duty to accept a higher risk to protect their patients. The authors of the New England Journal of Medicine article propose a secure, preserve, fight strategy. The secure step would entail immediately securing essential life-sustaining treatment areas, barricading entrances, securing all access points from inside, turning off all non-essential lights, and silencing phones and pagers. The preserve step includes staying away from windows and doors, moving patients to shelter if possible, and providing only the essential medical care required to preserve life. That means abbreviating any operative procedures using damage control principles and weaning anesthetics. As a last resort, and only when one's life or one's patient's life is in immediate danger, occupants should attempt to fight off the intruder. The New England Journal article concludes with the statement that there is a very real risk for active shooter events in healthcare facilities, that many caregivers may be able to comply with the run, hide, fight approach. However, a segment may not be able to do so. They contend that a secure, preserve, and fight strategy may allow them to fulfill their ethical obligations to their patients, while at the same time responding in a way that maximizes the odds for survival for their patients and themselves. The article is excellent and we recommend it. However, we would respectfully like to add the recommendation that all staff take the Stop the Bleed program. Launched in 2015 by the White House, the American College of Surgeons Stop the Bleed program is excellent. As a Stop the Bleed instructor, I believe that all caregivers, including clinical staff, professional administrators, and support staff, should all receive the training using pressure, tourniquets, and wound packing for severe bleeding. This is very important for hospital personnel in light of the risk of active shooters and the time it may take to neutralize the threats in a hospital. This also means that bleeding control kits should be located so that they are preferably close enough that they may be used within 3 minutes of a gunshot wound or major bleeding event. Ideally located next to AEDs, these kits are critical to life-saving care. Given that code teams will likely not be able to respond to a call when a violent intruder or active shooter is in a location, it is prudent to consider whether enough AEDs are available to staff and the public in a healthcare facility. In summary, I recommend the article and consideration of including Stop the Bleed training and CPR and AED training and use to all healthcare staff members. The life that is saved may be yours or someone you love.